The Rundown with Carrie Saldo podcast is funded by Armbrook Village, offering research-based arts, music, fitness, and lifelong learning programs at their assisted living and Alzheimer's care community in Westfield. armbrookvillage.com.
This is The Rundown, your weekly news and review from Western Mass. I'm Carrie Saldo. Our clues into the news crew this week: Greta Yoakum, investigations editor at the Springfield Republican, political consultant Ryan McCullum, and reporter Karen Brown with NEPM. Good morning, everyone.
Good morning.
Listeners, don't be shy. If you have questions about the topics at hand, email us, therundown@nepm.org. Okay, panel, let's run it down. This week, the Massachusetts Department of Public Health reported that opioid overdose deaths in Massachusetts declined 10% in 2023. The DPH says that this is the largest single-year decrease in opioid-related overdose deaths in 13 years. Karen Brown, you covered this for NEPM. For me, this was like a bit of statistics whiplash, because given the high rates of overdose deaths that were reported just last year, I was kind of like, how did this happen? What's behind this significant change?
What it means, actually?
Yeah.
I mean, I use these sort of statistic milestones as excuses to tell a bigger story. So there was an overall decrease by 10% in overdose deaths, but that's not across the board. So the big, 16% drop for white men. But there was
people of color, very different numbers.
Very different. Black men went up in the number of overdose deaths, and rural areas went up. And I talked to the sheriff of Franklin County, which is very rural, and he said there were, an additional 4 deaths last year over the previous. And so I don't know that you can necessarily use these across the board statistics to say that we don't have a problem anymore. But to me, it seems like, why not use those numbers to talk about why some groups are going down, others are going up. But still, more than 2,000 people a year are dying of opioid-related overdoses. So that, to me, is what the story is.
Yeah, and Ryan, when you hear those rates about people of color, what do you think?
Well, I think immediately about policy and how we address problems through government, and also just the continuation of healthcare disparities, racial healthcare disparities. So the policies that are made are driven towards helping white males. And why is that? Is it because they have access to beds? Do they know people more? Are the folks who are socioeconomically advantaged have access, or they have parents who have access to the solutions? Folks in the rural community and people of color don't have the same access. So policymakers really have to think when they're making solutions that they're equitable.
And I also think it's worth pointing out that when the headline is 10% drop, but it's an increase for people of color, why is that even the headline? So.
Greta, did you have something?
Yeah, I noticed also in the data, kind of to your point, Karen, about how it's not like a 10% drop across the board, that Holyoke was one city, so, right here in Western Mass, where deaths did not decrease last year.
Yeah.
And they went up.
Yeah.
And Pittsfield was among the communities in Western Mass that did see one of the decreases. So it's so different community to community. And as we've been talking about, these rural areas that we know are tucked into our hill towns are among the hardest hit. And when I think about rural communities, I think about the work of Dr. Ruth Potee, who's, Greta's shaking her head, the Opioid Task Force of Franklin County, because some of the work that they've done there has become a national model for how to address this and how to move the needle on this. But the other thing that I was thinking about when I heard these statistics is I feel like COVID really took opioids out of the headlines, opioid use out of the headlines, and people have in some ways forgotten about it. I mean, I remember it was just constantly in coverage. We did a town hall about it years ago on television, and the impact that it's had, and just the pervasive nature of this and how it continues to keep going. Rise Massachusetts, a nonprofit working to end the overdose crisis, released a statement on Wednesday saying that any decrease in deaths is positive, but did raise concerns about the high death rates that we talked about among people of color and in rural communities. Rise went on to say, quote, "We must continue to champion effective, equitable interventions and advocate for new measures to achieve a sustained downward trend in the crisis." And so when I hear them say new measures, novel approaches, phrases like that, I read that as code for, let's talk more about supervised consumption sites, supervised injection sites, where medical professionals are on hand to intervene in potential overdoses. They're highly controversial. They're not legal in Massachusetts. Ryan, there's legislation before the House and Senate Ways and Means Committee on this, but like I say, it's a highly controversial thing. Where are you at on it?
Sure, it's very controversial, and there's folks on both sides of that issue. And I also think, I'm no expert in drug use, but there's a very nuanced, probably, situation going on as far as drugs, and each community has certain dealers, and so is the good stuff, for a lack of better words, that's not tainted bags of whatever kind of drugs folks are using, in the places where there's dominantly white males, and there's the bad stuff in these other communities. And so, we'll have that fight. They'll have that fight at the legislature about open drug use, and monitored. And so folks, if they have issues, there's medical professionals on hand, but that's going to be a big fight in the communities.
Yeah, Karen, go ahead.
And to what Ryan's saying, a lot of what I think we should be talking about is why are people dying? So, which is a different reason from why they're using. And a lot of the reason is the drug supply and how toxic it is, and whether there's Narcan available to actually save someone from dying. So I feel like the more specific people and policymakers in particular are talking about how to reduce deaths as opposed to sort of statistical or general words, I think that's what's going to actually make a difference.
Absolutely.
Because I think it's really important to point out when we talk about decrease in death, and I haven't said it yet, it's not because people have stopped using this substance. It's because now
there's harm reduction measures.
They have access to Narcan. Greta.
Yeah, and just about the supervised consumption sites in potentially being in Massachusetts in the future with that legislation. I went to the supervised consumption site in New York City. There's 2 there, and did a story about it. And it was super interesting to see. I was able to go in the room where people, take the drugs and are supervised, and no one, at least last year when I was there, no one had overdosed at all. No one had died. So that was super interesting. And also they have tons of services for people. They have nurses, they have laundry, they have just a community center where people can spend time, places where people can check their drugs. So it's kind of like a sort of full community center wraparound services.
That's really cool that you got to see that. That seems really useful.
And the last point, if you look at the rural communities, access to hospitals is a key, right? And so, overdose deaths is one thing, but people overdose and they are brought back. And if you're close to Bay State Medical Center, there's a better chance you're going to get brought back than if you are in a rural community where you're not brought to a hospital.
Yeah, and perhaps using on your own. New York City, those sites that you mentioned. Also, Rhode Island recently opened sites. So there are a few places in the United States. Elsewhere, outside of this country, this is a more common practice. So it'll be interesting to watch how this evolves. Greta, you reported this week for The Republican also on this issue of opioids. Payments from the state's opioid recovery remediation fund will start to hit coffers soon, and that's going to bring millions of dollars to cities and towns across the state to help address this problem. Give us a little backstory about how and why this money is coming to these communities.
Yeah, sure. So across the country, there's been various lawsuits with attorney generals of different states, including Massachusetts, suing manufacturers, pharmacies, other types of companies involved in the creation and sale of opioids. And so there's been a bunch of different settlements in those cases, and that means funds coming into Massachusetts to help abate that problem. So some of the funds go to the state and they decide what to do with them and have a council who does that. And then some of the funds go directly to municipalities that opt in.
And Springfield's getting the biggest chunk in Western Massachusetts, right?
Yeah, they're going to get an estimated $7 million, from now till 2038. And that number could also go up since there's more lawsuits, including with Purdue Pharma. And so, they're trying to survey people, both residents and also residents with substance use disorder, to figure out how to best spend that money.
And Springfield's also doing a survey right now to try and do that, right?
Yeah, there's a survey online now on the health department's website for residents that I believe the deadline is July 1st to fill that out.
Do you know like what kind of oversight there's going to be of this $7 million?
That's a very good question. So there is a website or a page on the DPH's website where you can see how cities and towns have spent the money so far, because it has started to come in. They also have to file reports to the state government about how they use it, and as well as there's pretty like specific rules for what they can use it on. Like I believe they can't buy Narcan, which is something that you can't, because the state already does have programs to provide that for free to cities and towns. So they need to come up with new ideas.
It's just that there's not a great track record sometimes with following this money, like
Right.
with the gambling mitigation money. So
Yeah.
that seems like something we reporters should be
I was
following.
just going to say,
up.
Greta and Karen,
Yeah.
be sure to be on that, because Springfield spent about $300,000 thus far, right, Greta, on a few different, like a mobile truck that's helping with healthcare and a few other things.
Yeah, the truck they're planning to have it go out but haven't yet, and some funds to the fire department to help with responding to overdoses.
If people want access to that survey, we'll drop a link in our show notes for this week. So from a story that's about a call for survey participants to a survey that's already wrapped up, this story from James Pentland, the Daily Hampshire Gazette. The headline is Digital Life in Hilltown's Landmark Survey outlines how older populations use tech. And so the Northern Hilltowns Consortium of Councils on Aging surveyed folks age 60 and older in Hampshire County's 7 Northwest Hilltowns. Among the top findings, and surprising to me, 85%, not to be ageist, 85% of those surveyed are getting digital every single day, but not necessarily by choice. They're being kind of forced into it. Ryan, what's your reaction to that?
I mean, they have no choice, right? So a lot of folks are doing telehealth and having doctor's appointments online, and as folks age, they need to be plugged in so they can do that. COVID obviously, exacerbated the use of technology because folks couldn't necessarily go places, and so folks were, they had to learn how to use technology by like survival. One of the quotes that kind of struck me, and it's going to happen to all of us, and I never really thought about it, is a gentleman said, as technology advances, I'm going backwards, right? So I'm getting older, and it's harder and harder for me to learn the new, the technology, and technology is not waiting for you to catch up. So as you get older and it's harder to do, it's getting harder to do that way as well.
But
So
you would wish that you would hope that the technology is making it more user friendly, but I don't know that that's actually what's happening.
Yeah, I mean, it's tough.
Or is it an opportunity for us? Like these councils on agings have been wonderful. They have programming to help people navigate these systems, but also potential for collaboration here. Drop off a teen or a tween on a Wednesday and couple with an elder, and teen tween help me learn how to tweet or use X, and then also on the other end, the elders could help these young people learn how to navigate a face-to-face conversation. I don't know. Radical thoughts here on a Friday morning. One of my favorite parts of a survey response, and maybe it'll just go down as a favorite idea and come out of a survey. A gentleman told the survey respondents that he had met his girlfriend online and was looking for help to download an app that would help him do better in his gas mileage for his 90-mile trip to go and visit this new woman that he had met online.
He was in his 90s, no?
I was going to say, like, what age are they talking about? Because sometimes they're talking about elders who are, like, 55 years old. I was like, that's younger than me.
Well, this survey was 60 plus, so
Yeah, okay.
maybe.
Yeah.
Perhaps
I'm
not.
hoping they've met in person already.
That is also another fantastic point. Well, there's still more to come here on the Rundown. Stick with us. Well, the panel will have plenty to say about UMass Amherst and Williams College as they grapple with student concerns around their institutional investments. And a year after losing the East Hampton position amid controversy, Vito Perrone is offered Hampshire Regional Superintendent position. Have a question about this week's news for our panel? Email the rundown at nepm.org. I'm Carrie Saldo. We'll be right back. And And we're back. You're listening to The Rundown. I'm Carrie Saldo. Hitting this week's news high notes from the 413, Greta Yoakum, Ryan McCollum, and Karen Brown. Welcome back to all of you. UMass Amherst and Williams College both in the news this week as they grapple with student concerns around institutional investments and calls to divest from any ties to the war between Israel and Hamas. So a quick reminder, this year, protesters on numerous college and university campuses in Western Mass and much wider have demonstrated against Israel's military offensive in Gaza in response to the October 7th attacks by Hamas. This week, reporting in Williamstown and Amherst told tales of two very different approaches to similar situations. Let's address Williams College first because, frankly, it's a lot less complicated. The Berkshire Eagle's Sten Spinella reported that the Williams College trustees met and discussed the concerns raised by its students this spring during the pro-Palestinian rallies I mentioned. Ultimately, the trustees opted not to divest. However, the trustees say that they will beef up transparency around what Williams College has invested in. Now, to UMass. Dan McGlynn reporting for the indie news site The Shoestring. The headline here, Weapons, Fossil Fuels, and Illegal Settlements Inside UMass's Investment Portfolio. McGlynn did a deep dive into the University of Massachusetts Foundation, which is the private nonprofit corporation that manages the public university's endowment. Not a simple task taken on by this person. The foundation has $1.3 billion in total assets, according to its 2023 endowment report. And then that piece of information became the string that the Shoestring really got to pull on this issue because institutional investors who manage more than $100 million in assets have to file disclosures with the Securities and Exchange Commission. So using that and some other tools, McGlynn was able to isolate some of the drops, some of the small drops in this giant pooled investment, right? So two specific examples. Palantir, I forgive the pronunciation there, a CIA-backed company that sells AI surveillance systems to the U.S. police departments and some Israeli military. And then Elbit Systems, one of Israel's largest weapons manufacturers, are among the groups getting money from this investment. Now, as I said earlier, students at UMass and elsewhere have called for divestment from weapons manufacturers and ties to Israel. Reaction to reporting here from the panel. I gave a very brief summary, and I know it was lengthy, but it's an extensive report. Shoestring.org for more details.
Well, I just want to give kudos to a student journalist who did this, who really did some shoe leather reporting, and it's hard to take data and to go to the SEC and to look up these records, but this is the kind of reporting that actually gets at what's going. So I just want to put that out there. But
yeah, no, it's tough, and especially with these ETFs, right? So where
exchange traded funds.
Yeah, and so where it's just a fund and you're just putting money in there, and then all these other different things are being invested in, and you just trust that. They just, and it's kind of a side note, they just started an ETF to follow congressional trades, right? And so if Nancy Pelosi or Mitch McConnell make a big buy, it goes into an ETF, and you can actually tail what Congress is investing in, which is a whole other discussion.
But also it speaks to that issue of transparency, which the students at UMass were saying, we want more of that. Or at Williams College, rather, were saying we want more of that. And these students at UMass as well. The go ahead, Karen.
Well, I just to that point, I think that it's really interesting to make the distinction between transparency, like being lied, people hate being lied to. Students, activists they want equal footing in their demands. So at the very least, they don't want to be lied to about what's actually happening, which is a separate issue from whether the universities are going to do what they demand, what the students demand. And I think that it's very smart at the baseline for universities to say, we may disagree on how we're going to move forward, but we're at least telling you what we're actually doing and what is happening. And I think that's a way to take off a little bit of the drama and the anger that students are feeling.
And maybe now with this deep dive reporting by McGlynn, universities might say, well, because I think one of the things that universities or colleges often say is it's too complex. Right. We can't begin to have this discussion because it's too complex. And yes, it's complex. but he did the work. So perhaps it's an opportunity to open up a broader discussion. Now, on the other end, the University Foundation does have an avenue for potential divestment, McGlynn pointed out. It's called the Socially Responsible Investment Advisory Committee. And for over a decade, students and faculty at the university had been pushing for divestment from fossil fuels. And then in 2016, the UMass Board of Trustees did vote to divest direct holdings in companies linked to climate change. The university did tout this decision, but then the shoestring found out that, quote, the university continues to invest heavily in every industry that student movements have targeted for divestment in recent years, prompting members of the university community at all levels to question UMass's commitment to ethics of transparency and shared governance. Now, the UMass Foundation didn't respond to the shoestring's request for comment. Frustration among students here who feel like they made some inroads around the climate issue, but then the shoestring finds this other bit of information.
Yeah, it begs the question, like, what is the enforcement of that, right? So, oh, yeah, we're not going to do fossil fuels anymore. And then if they do, then so what? You know, like, and they're able to hold over the students and the taxpayers' heads, right? Because we all invest in UMass through taxes. Cost, right? So they're able always to say, well, do you want it to cost more? We're trying to make this the university more money so you don't have to pay as much. They try to use that as leverage.
It'll be interesting to see if all of this light shed on it through this investigation actually moves the needle, or if it just kind of quietly moves on. There's another element to this story that we don't have time to fully dive into today, but I'll direct you to theshoestring.org for the details. In brief, there's a disagreement between the students and Chancellor Reyes over whether he reneged on his word to have the trustees review their divestment proposal. So more on that at theshoestring.org. I'm going to have us turn now to the superintendent shuffle. Yep, 2024 is proving to be the summer of the superintendent shuffle here in Western Massachusetts. Several districts across our communities are either in need of a new superintendent or in negotiations with an incoming hire. And this week, the Hampshire Regional District tapped Vito Perrone as its new superintendent. There was coverage of this from NEPM, Mass Live, the Daily Hampshire Gazette. Last year, Perrone almost got the superintendent position in nearby East Hampton. However, that offer was rescinded because there were disagreements over contract requests and an email he sent using the word ladies. This got huge national coverage. I'm sure many of you will remember. But still, John Lumbra, a school committee member in Hampshire Regional, said last year's issues in East Hampton were barely a thought that were brought up during the public interview process here for Perrone. Thoughts on this from any of the panel?
I mean, I'm impressed that anyone was willing to go back to that controversy, the ladies' comment, and whether that was reason enough to keep somebody off the superintendent job. I mean, I think at this point the proof is in the pudding. How is this gentleman going to be? Am I allowed to say gentleman? That's a good question. Is going to be on the job, and ultimately, I think families want to see how their kids are educated, and they are probably ready to be done with the minutia of this particular scandal.
For me, I hadn't paid very close attention to this happening at the local level last year. I kind of got the national version of it, which kind of sort of seemed like a Daily Show sketch to me on any given day. The headlines were either, white man held accountable for microaggressions finally, or woke machine once again, dethrones white male. But then when I revisited it this week, it was really important for me to see that it was about much more than that. There were disagreements over the contract and whether Mr. Perrone was asking for too much money from East Hampton. So for me, two big takeaways here are the words we use matter, especially in a professional setting, and employers talk about salaries and benefits much earlier in the hiring process. Those are...
Yeah, and I think also one of the larger takeaways is public education as a whole there's been a microscope on it, and there's culture wars at the school board level over books or pride flags or what have you that are just taking place at the town level or city level, and these are pretty thankless jobs, right? And so being a superintendent, it comes with a great salary, but your life is under that same microscope. And I have friends who are in education who have, gone from being teachers to principals, who now are like, you know what, I'm going to be a professor at a college because it's way less stress. The parents aren't bothering me all the time. I'm not in the newspaper because of this, that, or the other thing. And so it strikes the political piece, right? So you were just mentioning that it went national. Both sides are politicizing it. And so this guy is just probably trying to be a superintendent. And he's kind of kept his head down. So I give him credit for that. Like,
he's working as the interim in West
Yeah.
Springfield, so certainly hasn't left the industry.
yeah, but it's not like he went to Fox News and started like taking up the mantle, which a lot of people could
some
have
do.
done, right?
Yeah,
And
yeah.
so he kept his head down, and it seems to be paying off.
Well, I'm going to move us to a story, Karen, that you covered this week. The latest on the Springfield Police Department's Greg Bigda, and I struggled to find an adjective here, so I'm just going to say that the Police Commission this week voted the one-time narcotics officer off of the payroll, but they did not fire him. What's going on?
Right. So Greg Bigda has sort of become the symbol of excessive force on the Springfield Police Force, based on some events of 2016 in which he was found bullying and threatening young people. And basically, at this point, he's trying to get recertified, but he is no longer going to be able to do that with pay. The mayor of Springfield thought he should have been kicked off entirely. So did at least one member of the police commission. So it's sort of, this shines a light again on what are the consequences to police misconduct. But the Bigda drama sort of keeps going up and down and up and down.
Greta.
Did they say in the meeting, like, what the reason was, the board, for not, firing him?
Well,
Like,
he
what was
is
the-
appealing whether he's being recertified or not. So his lawyer, who I interviewed, said he thinks that's probably this was the most cautious move, was to
legal
suspend
liability.
him pending the appeal. But I don't know if that's exactly why.
Well, more to come on that story for sure. All right, let's get to our predictions, scoops, or praise this week, where we ask our panel to do something against their very nature, spill the tea about a story they're working on, make a prediction about the news, or heap some praise on a newsworthy nugget that you liked this week. Greta, how about for you? Prediction, scoop, praise, where are you at?
Yeah, so at the Republican, we're working on a series called Faces of the Housing Crisis. We put out one story last weekend, and so basically we're trying to do more stories about the housing crisis and really humanize it. And we have a story that I wrote that's coming out in the coming days. So that's my scoop, I guess.
That's been wonderful. Good job.
Thank you.
Congratulations.
And it's such a vital issue that's happening here and has such huge impacts for so many people in our region. Karen.
Well, I'm going to put a plug for NEPM's podcast that I am the host and producer of, The Secrets We Keep. All episodes have been dropped, and the most recent one is on money. Why do people keep their income secret? Why do people have such a hard time talking about money? And if you want to find out my salary, listen to the episode.
It's the only episode I haven't listened to. I'm going to catch it.
Thought it was great.
The state ballot initiatives, there's 6 of them. Those are going to take up a lot of oxygen all of a sudden. I don't think people are paying attention, and they're all pretty, I don't want to say cool issues, but they're issues that, make sense. It's not like it's, this, 1% off a tax here or there.
They're very
It's-
relatable
Yeah,
this time around.
so it's whether or not MCAS should be a graduation requirement. It's whether the auditor should be able to audit the legislature, regulating psychedelics and shrooms, giving servers tipped wage increase, and then lastly, this big fight over rideshare and delivery companies, whether or not those drivers should be independent contractors or employees. So all things that are going to affect our daily life, the citizens of Massachusetts actually have a voice on that, which is pretty cool.
And we'll keep talking about all of those on the rundown. I feel like we could spend a full program on everything you just mentioned on that list. I have praise this week, as Karen did, for Dan McGlynn's investigation into that UMass investment portfolio. According to McGlynn's bio, he's an independent reporter studying journalism currently at UMass, and he's a summer intern there at the Shoestring. And I'm just super grateful that the days where interns or errand runners are over. The short version of my worst intern errand, I was set to fetch something. It required me taking a New York City bus and a subway. Hours later, I returned with a single quill feather in my hand.
But look how far
kinda
you've come,
cool.
that all played a part. Yeah.
All right. My thanks to the Rundown panel this week. You have been listening to The Rundown, which you can catch every weekday at or Friday at 9 on NEPM.